Hello and welcome to everyone. Today we're discussing the anatomy of the oral cavity. Let's start with the mouth cavity. The mouth cavity is divided into vestibule of the mouth and mouth cavity proper. The vestibule of the mouth is the slit-like space present between the lips and cheek externally and gums and teeth internally. I mean, it's the space really you put your toothbrush inside. While the mouth cavity proper is the actual cavity and it's communicating posteriorly with the pharynx and bound the oropharyngeal isthmus, which is formed by palatoglossal muscle or palatoglossal arch on both sides. Now we're talking about the palate. The palate is divided into hard palate and soft palate. The hard palate is the anterior 2/3, which is bony, and the soft palate is the posterior 1/3. And there is the median raphe in the midline. The hard palate is covered by mucous membrane and with bilaterally corrugation on both sides. The hard palate is composed of palatine process of maxilla, and this is the palatine process of maxilla, and horizontal plate of palatine bone, and this is the horizontal plate of palatine bone. Now we're talking about the soft palate. The soft palate is the posterior part of the palate, and this is the extend from the posterior border of the hard palate and covered with mucous membrane and end with this part called uvula. This is the uvula. Another picture for the palate. This is the hard palate and this is the soft palate. Another cadaveric picture. This is the sagittal section and this is the hard palate and this is the soft palate. Now we're talking about the muscles of the soft palate. Firstly, there is tensor palatine muscle. This is the tensor palatine, arise from scaphoid fossa and the spine of sphenoid to be attached into the palatine crest right here. It's innervated by the mandibular nerve. It tense or tighten the soft palate. Second one is the levator palatine muscle, which is attached from or originating from the petrous part of temporal bone right here and the medial part of pituitary canal to be inserted in the palatine aponeurosis right here. It's innervated by cranial part of accessory nerve through pharyngeal plexus. It causes elevation of the soft palate. The third one is the palatoglossus. From its name, it arises from the palate to the glossus. It arises from the palatine crest to be attached to the side of the tongue. It's supplied by cranial part of accessory nerves through pharyngeal plexus. It narrows the oropharyngeal isthmus. What is the oropharyngeal isthmus? This is the oropharyngeal isthmus between the palatoglossus muscle on both sides. This is the palatoglossal arch and this is the palatoglossus arch formed by palatoglossus muscle on both sides. After that, there is the palatopharyngeus muscle. It arises also from the palatine crest to be inserted in the wall of the pharynx and the lamina of the thyroid cartilage. It's innervated by cranial part of accessory nerves through pharyngeal plexus. It narrows the pharyngeal isthmus during deglutition. The last one is the musculus uvuli. This is muscle right here. This section is the coronal section from the root of the nose and this is the uvula or the musculus uvulae. Exactly, it's originating from the nasal spine to be attached into the mucous membrane of the uvula. It's innervated by cranial part of accessory nerve through the pharyngeal plexus. It retracts and elevates the uvula. This picture, to sum up, there is two muscles above, tensor palati and levator palati, and two muscles below, the palatoglossus and palatopharyngeus. And this also for, this is the palatoglossus arch, and this is the palatopharyngeal arch, and in between there is the tonsil. Now we're talking about the sensory nerve supply. Sensory nerve supply tests sensation, secretomotor to the palatine glands, and motor nerve supply. First, start with sensory nerve supply. It's divided into hard palate and soft palate. The hard palate is innervated by nasopalatine nerve and the greater palatine nerve right here, and soft palate is innervated by lesser palatine nerve and the glossopharyngeal nerve. Secretomotor to the palatine glands through the facial nerve, through its greater petrosal branch, which is carry preganglionic nerve fiber, which relay in sphenopalatine ganglion and send postganglionic fibers to the lesser palatine send the postganglionic fibers to the palatine glands through the lesser palatine nerve. Nerve supply of the palate test sensation through the lesser palatine nerve. This is the motor nerve supply. All muscles of the palate supplied by cranial part of accessory nerve through the all muscles of the palate supplied by cranial part of accessory nerve except the tensor palati, which is supplied by mandibular nerve. The arterial supply of the palate, there is the greater and lesser palatine arteries arise from the maxillary artery. Ascending palatine artery arise from the facial artery and the palatine branch of ascending pharyngeal artery. Now to turn to the venous drainage of the palate, pterygoid and the pharyngeal plexus. This is the pterygoid venous plexus. Lymphatic drainage of the heart of the palate. The hard palate drain into submandibular lymph node, and the soft palate drain into upper deep cervical and retropharyngeal lymph node. Now we're talking about the tongue. The tongue is divided into anterior 2/3 and posterior 1/3 by a sulcus called sulcus terminalis. This is V-shaped sulcus terminalis. The dorsum of the tongue of anterior 2/3 covered by papillae of different types, but the posterior 1/3 is devoid of papillae and contain aggregation of lymphoid tissue called lingual tonsil. The ventral surface of the tongue. If you raise your tongue against your hard palate, you will find the structure called frenulum linguae. Lateral to this structure, there is the lingual artery, then lingual nerve, and after that there is deep lingual vein, and the most lateral structure is the plica fimbriata, which is fold of mucous membrane. Muscles of the tongue, including intrinsic muscles and extrinsic muscles. Intrinsic muscles confined to the tongue, not attached to the bone, and supplied by hypoglossal nerve. They are superior longitudinal right here and inferior longitudinal right here. They cause shortening of the tongue. And the other group is the vertical group, this vertical group right here, causing thinning of the tongue. and transverse group right here, causing narrowing of the tongue. Now we're talking about the extrinsic muscle of the tongue. First of all, styloglossus muscle. Styloglossus muscle arises from styloid process to be attached to the tongue, to the side of the tongue. It's supplied by hypoglossal nerve. It draws the tongue upward and backward because its position right here. It pulls the tongue upward and backward. Genioglossus muscle. The second one is a huge muscle right here. It's fan shaped like this. It's arises from superior genial tubercle of the mandible to be inserted in the whole length of the tongue. It's innervated by hypoglossal nerve. With the other side, it protrudes the tongue outside. The third one is the hyoglossus muscle. The hyoglossus from its name arises from the hyoid bone to be inserted on the tongue. This is the hyoglossus muscle. It's innervated by hypoglossal nerve. It causes depression of the tongue. The last one is the palatoglossus, as we mentioned before in the palate. This picture to sum up the different types of the muscles of the tongue. First of all is the styloglossus, and this is the hyoglossus, and this is the genioglossus. This is the cadaveric picture for the genioglossus muscle. This is the tongue. Nerve supply of the tongue. Sensory start with general sensation, pain, temperature, like this. The posterior 1/3 of the tongue is carried, the general sensation carried by the glossopharyngeal nerve, while the anterior 2/3 is carried by lingual nerve. Taste sensation. The posterior 1/3 of the tongue the taste sensation is also carried by glossopharyngeal nerve, while the anterior 2/3 of the tongue is carried by chorda tympani. General and taste sensation of the most posterior part of the tongue are carried by internal laryngeal nerve or branch of vagus nerve. Now, what about the motor innervation of the tongue? All muscles of the tongue are supplied by hypoglossal nerve except the palatoglossus, which is supplied by cranial part of accessory nerve through the pharyngeal plexus. Now we're talking about the arterial supply of the tongue. This is the common carotid, and this is the external carotid, and this is the internal carotid. First branch is to the tongue is the lingual artery. This is the lingual artery, arises from external carotid, and ascending pharyngeal. This is the ascending pharyngeal, and this is the tonsillar artery, arises from the facial artery. Now about the venous drainage of the tongue. Lingual vein, which drain into the internal jugular vein. This is the lingual vein, and drain into internal jugular vein. Lastly, the lymphatic drainage of the tongue. The tip and frenum of the tongue drain into submental lymph node. Peripheral lymphatics from the anterior to third drain into submandibular lymph node. Central lymphatics from the anterior to third drain into deep cervical lymph node, and the posterior third of the tongue drain into deep cervical lymph node. And thank you for listening.